Hey everyone, great answers to the discussion question. I'd like to work through it and show you how I'm thinking about this question. So here we have the story of Danielle, who has moved to Wayne State from a small town in Illinois and is having some difficulties. And so the first task is to figure out, does she qualify for a psychological disorder in general, according to our three-part definition? So we're looking for personal distress, dysfunction or disability, and some violation of some kind of social norm. So personal distress, it's quite clear that something is bothering her, that she feels like she has a dark cloud over her, that, part of this is, it's just a vignette that's a bunch of words, but you can imagine what her presentation would be like in person. She would likely be teary, based on what's described here. You really get the sense that she's seeking help for a problem that she has. So that's just a little marker of distress. Now, dysfunction. We see that she's having difficulty making friends. She's having difficulty with soccer, difficulty with her academics. It seems to be that there's something that's bothering her, that's causing her distress, that is also spilling over into other areas of her life and causing her difficulties. And then violation of social norms. This one's a little bit tricky. Based on her description, she kind of sounds like a normal college student who's going through some difficult things. So it may not feel like a total violation of or of abnormal behavior for a college student. But then again, we do see that her soccer coach notes that something's different about her, that she's off, that she seems to be doing everything slowly, that she seems to be weighed down by something, right? So there's something about her behavior, her social interactions, or what other people are seeing in her that is different. And so we might say that that could be considered a violation of social norm. But that one's a little bit iffy. As we've discussed before, not all disorders translate into something that is very, very clearly deviant from the social norm. In fact, for college students to be depressed, unfortunately, or to be sad or anxious or stressed, unfortunately, that's quite a common finding. So, some of you commented on that. It might not be a deviation from social norms, and that's exactly true. It might not be. Then next, so I would likely say that she does meet the criteria for a psychological disorder. And then the question is which disorder? So among the depressive disorders listed in the DSM-5, what is most likely the best explanation, and almost everyone picked up on this, was major depressive disorder. We definitely see that she shows a depressed mood. She shows markedly diminished interest or pleasure in formerly pleasurable activities, what we call anhedonia. She's lost interest in doing things that she used to really, really enjoy. She shows fatigue, a diminished ability to think and concentrate, clinically significant distress and impairment in other areas of life. So for her occupational, whenever you see that, for a student, your occupation is school. So if your distress is causing you a disorder or difficulties in school, then we would say that that applies. We also see psychomotor retardation described here that was observed by her soccer coach, as well as perhaps some other symptoms that might be noted there. So upon reading this little story of Danielle, what should immediately jump to mind is major depressive disorder. And as I always say, I would not automatically give her that diagnosis. There would be much more testing, probably some more interviews, as well as having her take some personality measures or some self-report questionnaires to figure out how severe her depression is. How does it compare to other people in a statistical way? As well as other ways of observing which criteria or which diagnostic category best suits her. Some of you brought up some other diagnostic categories that may apply here, and I think they're worth mentioning as well. Yeah, dysthymia is a possibility as well. Um, uh, uh, and what we see in dysthymia is something that is much longer, something that is for at least 2 years. So I think in Danielle's story, we don't have information that she's been experiencing that for at least 2 years. So we would not go with that diagnosis. And dysthymia, generally, we're talking about something that is very mild and persistent over time, whereas major depressive disorder is something that we expect or that we commonly think of as being very, very serious or greater in severity than dysthymia. And then also another interesting one is premenstrual dysphoric disorder. Now, this is brought up by Asia, and that was a really great observation we specified that these difficulties have been going on for about a month, not several months. So that's something that we would definitely want to follow up on in an interview and say, have these difficulties, have you noticed any cycle? Have they come and gone? Specifically looking to see if these distressing symptoms uh, come and go along with her monthly cycle. And if that's the case, then we might bring up this disorder as another possibility. But since that information has not been presented, and we only have the information that she's been experiencing these symptoms for about a month, then what most clearly fits is major depressive disorder. I really like how you guys are thinking about these answers. Really great job so far. I'll encourage you, if you can, when you're listing the diagnostic criteria that are met, some of you did this, is just to list them out by number. Actually write the number that you see here on the DSM and say how they meet that specific criteria, or the number or the letter would be useful. Keep up the great work.